Welcome to this video entitled, How Patients Should Take Their Medications Properly for Maximum Benefit with the Least Side Effects. In this video, I'll show you exactly how to take your meds properly, so you get the maximum benefit with the least side effects. These tips could literally protect your health, or save a life. Let's get started. Before we dive into how to take your medications correctly, let's talk about why this matters more than most people realize. Would you believe me if I told you that over 50% of people take their medications incorrectly? Well, that's not just a small mistake, it's a silent crisis. Every year, people land in the emergency room, not because the medicine failed, but because it wasn't taken the right way. Incorrect timing, wrong combinations, skipped doses, or even stopping too soon can turn something meant to heal you into something that harms you. And here's the truth: medications can do amazing things, but only if you take them the right way, which includes the following. 1. The right dose. Not too much, not too little. 2. At the right time, because your body runs on rhythms and routines. 3. In the right way, with or without food, crushed or whole, it matters. And 4. For the right duration, stopping too early can lead to resistance or relapse. When you follow these 4 simple principles, you unlock the full power of your treatment, with fewer side effects, better outcomes, and faster healing. Let's make sure your medication works for you, not against you. Now that you know why this is so important, let's walk through the 6 simple rules that will change the way you take medications, forever. Alright, now that you understand why taking medications the right way is life-changing, let's dive into the 6 golden rules, simple steps that can protect your health, your wallet, and maybe even your life. First things first, know what you're taking, and why. It's not enough to say, the white pill, or the capsule for my pressure. You should be able to say, this is amlodipine. It lowers my blood pressure and helps prevent stroke. Knowing this keeps you safe in emergencies, helps avoid mix-ups, and makes you more confident in your own care. Number 2. Follow exact instructions. Medicines are powerful tools, but only when used exactly as prescribed. Should you take it with food? On an empty stomach? Morning or night? These little details affect how well your body absorbs the drug and whether side effects show up. For example, some antibiotics need to be spaced 12 hours apart, not just taken whenever you remember. And certain pills lose their power completely if taken with coffee, milk, or antacids. Always follow the label, ask your pharmacist, and never assume. Number 3. Don't skip or double doses. This is where many people slip up. You miss a dose, you panic, and then you take double the next time. Wrong move. That can cause serious side effects or even overdose, especially with heart, blood pressure, or insulin medications. Instead, set reminders, use a pill organizer, or ask your pharmacy for a blister pack with days and times clearly marked. Your memory and mine aren't perfect, but your system can be. Number 4. Watch for interactions. Here's a hidden danger: drug interactions. Your medication might be safe alone, but when mixed with another medication, food, or supplement, boom, problems. Common culprits: grapefruit juice, alcohol, herbal teas, and even over-the-counter pain relievers. Always tell your doctor or pharmacist everything you're taking, even natural remedies. If you're not sure, ask. It could save you from liver damage, mood swings, or worse. Number 5. Store your medications properly. Some of us store medications in the bathroom. Guess what? That's one of the worst places to keep them. Steam from showers and temperature swings can weaken your medicine over time. Unless the label says refrigerate, store them in a cool, dry place, out of sunlight and heat. And always, keep them far away from children and pets. And, finally, number 6. Don't stop early or abruptly. Let's be real. We all feel tempted to stop taking medications once we feel better. But that's when the real risk begins. Stopping antibiotics too early can lead to resistance, meaning they won't work the next time. Stopping antidepressants suddenly can cause severe withdrawal symptoms. Stopping blood pressure or heart medications abruptly, that can trigger a heart attack or stroke. Never stop or change your medications without checking with your doctor, even if you feel fine. These 6 golden rules might seem simple, but following them could be the difference between a full recovery or a preventable crisis. So remember, know your medications, follow instructions, stick to your schedule, check for conflicts, store them right, and don't stop too soon. Your future self will thank you. Next, let's break each rule down with real-life examples and some of the most common mistakes to avoid. Let's kick off with rule number 1, and it's a game changer. You must know the name and purpose of every medication you're taking. Know both brand and generic names. Medications often come with 2 names, the brand name and the generic name. For example, you might see Zestrol on your bottle, but its generic name is lisinopril. It's the same medicine, but knowing both names can prevent confusion, especially if your doctor or pharmacy switches brands, which happens all the time. In an emergency or when traveling, you may only have access to one name, and not knowing it could delay treatment or cause a dangerous mix-up. Understand why you're taking it. Now here's the key. Don't just take something because the doctor said so. Understand what it does inside your body. Is it lowering your blood pressure? Reducing inflammation? Controlling your blood sugar? When you understand the purpose, you're more likely to take it correctly, and less likely to stop it early. Imagine this. You're rushed to the emergency room, and someone asks what medications you're on. You say, I take a little white pill. I think it's for my heart. Maybe for pressure. That's not helpful, and it could be dangerous. Keep a written or digital list. Don't rely on your memory. Even the best of us forget. Keep a list on your phone, in your wallet, or use a free medication tracking app. Include the medication name, dose, how often you take it, and why you take it. Better yet, email a copy to yourself and share it with a trusted family member or caregiver. For example, instead of saying, I take the white pill in the morning, say, I take 10 milligrams of lisinopril for high blood pressure, once daily in the morning. This one shift in how you speak about your meds could literally save your life. When you know exactly what you're taking and why, you move from being a passive patient to an active partner in your health. And that's where real healing begins. Coming up, rule number 2, the crucial reason why following the exact instructions matters more than you think. Now let's move on to rule number 2. Follow the instructions. This might sound obvious, but it's where most people go wrong, even without realizing it. Some medications need to be taken with food to prevent nausea or to help them absorb properly. Others, they work best on an empty stomach, and food might actually block their effect. Think about iron tablets. If you take them with milk, tea, or even cereal, your body may absorb much less iron than needed. That's not just wasteful, it's dangerous if you're treating anemia. Timing matters more than people think. Once a day usually means at the same time every day. But something like an antibiotic that says every 8 hours That means spacing out doses evenly, not just taking 3 pills whenever you remember. Medications like these need steady levels in your body to work properly. Missing doses or bunching them up can make them useless. Another key detail: how you take it. Some tablets are chewable, made to dissolve in your mouth. Others are extended release or have special coatings, and must be swallowed whole. Never crush or split tablets unless your doctor or pharmacist tells you it's safe. You might destroy how the medication is released, and end up with too much too fast, or not enough at all. We will now focus on common mistakes that can cost you. Milk blocks iron. Always space iron supplements at least 2 hours apart from dairy. Skipping or taking antibiotics at the wrong time leads to drug resistance, meaning microorganisms such as bacteria stop responding to them. This is one of the biggest global health threats today. Levothyroxine, a common thyroid pill, gets blocked by coffee. Even black coffee can reduce how much of the hormone your body absorbs. Wait at least 30 to 60 minutes after taking it before your morning brew. Every pill comes with a rule book, and when you follow those instructions exactly, you unlock the medication's full power while avoiding side effects and long-term complications. If you're ever unsure, just ask your pharmacist. They're there to help. Up next, rule number 3: why skipping or doubling doses can do more harm than good. Let's talk about a mistake that millions of people make, often without even realizing it, and that's missing doses or doubling up on medication. This brings us to rule number 3: don't skip or double dose. When you skip a dose, whether it's once or often, your medication can lose its full power. Why? Because many meds rely on a steady level in your bloodstream to do their job. Imagine you're taking blood pressure medication. Missing doses could cause your pressure to rise again, often without warning, and that puts your heart, brain, and kidneys at risk. Now what about doubling up? Maybe you missed your morning pill and try to catch up by taking 2 at once. Stop right there. That can be dangerous, especially for medications that affect your heart, blood sugar, or nervous system. Taking a double dose could cause dizziness, low blood pressure, fainting, or worse. If you ever miss a dose, here's your golden rule: don't panic. And don't guess. Call your pharmacist or healthcare provider. They'll give you the safest advice for your specific medication. Some medications should be skipped and resumed. Others might need to be taken later, but it's never one size fits all. Here are 3 easy habits to avoid mistakes. Set phone reminders. Use your smartphone's alarm or a medication app to remind you exactly when it's time to take each dose. Use pill organizers. Those weekly or monthly pill boxes are lifesavers, especially if you're taking more than one medication a day. They help you see at a glance what you've taken and what you haven't. Ask for pharmacy-prepared blister packs. Some pharmacies offer pre-filled bubble packs, sorted by date and time. These are ideal for seniors, busy caregivers, or anyone who just wants peace of mind. The key takeaway here: consistency is everything. Skipping doses or doubling up can turn a helpful medication into a risky one. But with the right tools and a simple routine, you can take your meds safely and confidently, and get the results your doctor intended. Coming up next, rule number 4: one of the biggest hidden dangers in modern medicine: drug interactions. Here's how to protect yourself. Now here's a rule that could quite literally save your life. Rule number 4: watch for interactions. Because sometimes, it's not the medication itself that causes problems, it's what you take with it. Your medications don't exist in a vacuum. They can interact with everything you put in your body, including food, drinks, supplements, and even other prescriptions. Here's the thing most people don't realize. Even something as innocent as a vitamin or herbal tea can interfere with how your medication works, or make side effects worse. Grapefruit juice. Sounds healthy, right? But grapefruit juice can dangerously boost levels of certain drugs in your bloodstream, especially cholesterol meds, blood pressure pills, and even some anti-anxiety medications. Alcohol. Alcohol doesn't just mix poorly with painkillers or sleep meds. It can also increase drowsiness, liver strain, and reduce how well your medication works. St. John's wort. It's a natural supplement, but St. John's wort can speed up the breakdown of many meds, including birth control, antidepressants, and HIV medications, making them less effective or even useless. Bottom line. Just because it's over the counter or natural, doesn't mean it's safe to mix. Here's your golden rule. Always, and I mean always, tell your doctor and pharmacist about everything you take. Not just prescriptions. Tell them about vitamins, herbal supplements, protein shakes, energy drinks, essential oils, and yes, even that bedtime tea. The more they know, the better they can protect you. Because preventing dangerous interactions is a team effort, and you're the most important player. Next time you visit your doctor or pharmacy, bring an up-to-date list of everything you take, or better yet, snap a photo of your medicine cabinet. So, remember, interactions aren't rare, they're incredibly common. But with a little awareness and open communication, you can avoid surprises and keep your medications working safely and effectively. Up next, rule number 5. Where you keep your medications might be hurting their effectiveness without you even knowing it. Let's talk about proper storage. Let me ask you something. Where do you store your medications? If you just thought, the bathroom cabinet, we need to talk. Rule number 5 is all about storage, because where you keep your meds matters just as much as how you take them. And the bathroom, as convenient as it may seem, it's one of the worst places. Steam from showers creates humidity and temperature swings that can break down the ingredients in your medication, making them weaker or even unsafe. So if you're storing pills next to your shampoo, it's time for a change. Instead, keep your meds in a cool, dry area, away from heat, moisture, and direct sunlight. Think, a kitchen cabinet away from the stove or a bedroom drawer. Why? Because medications are chemically sensitive, and just like food, they can spoil or degrade when stored in the wrong environment. Now here's something else many people forget. Some medications require refrigeration to stay effective. Common examples: insulin for diabetes mellitus, certain eye drops, some types of antibiotic liquids or biologics. Always check the label or ask your pharmacist, because storing these medications at room temperature can destroy their potency. And here's a crucial safety tip. Always keep your medications out of reach of children and pets. Every year, thousands of emergency room visits happen because little hands, or curious paws, get into pill bottles. Even a single dose of some meds can be life-threatening to a child or small animal. Use child-proof containers, keep everything locked away, and never assume it's too high for them to reach. Here is a quick recap tip section. Remember to do the following. 1. Avoid the bathroom. 2. Stick to cool, dry spots. 3. Refrigerate when necessary. And 4. Lock medications up safely. Remember, proper storage is silent protection. It keeps your medications stable, effective, and safe for when you need them most. Coming up next, the rule that's more powerful than any prescription. Stay informed and ask questions. You deserve to understand every pill you take. Let's dive in. Here's one of the most dangerous mistakes patients make, and most don't even realize it. Stopping your medications too soon. You feel better. You think, I don't need this anymore. And before you know it, you've just sabotaged your treatment. Let's be crystal clear. Feeling better is a result of the medication working, not a signal to stop. Quitting too soon can bring your symptoms roaring back, or worse, cause serious harm. Antibiotics are a perfect example. You might start feeling normal after a few doses, but if you stop early, the bacteria can survive and adapt. That's how we get antibiotic resistance, one of the biggest public health threats today. Always finish the entire prescribed course, even if you feel fine. And if you're on long-term meds like antidepressants or blood pressure medications, stopping suddenly isn't just ineffective, it can be dangerous. These medications must be tapered off slowly, under the guidance of your doctor. Why? Because your brain and body adjust to these drugs over time. Suddenly cutting them off can trigger a storm of effects. You might experience headaches, dizziness, nausea, or anxiety. These are signs of withdrawal, your body trying to cope without the medication it relied on. You could feel even worse than before you started. Anxiety, depression, blood pressure spikes, seizures, yes, it's that serious. And with some drugs, especially antibiotics, you're not just risking your own health. You're contributing to the global threat of drug-resistant infections. Never stop your medications suddenly, unless your doctor specifically tells you to. Even if you feel fine, even if you think you don't need them, always talk to your pharmacist or prescriber first. They'll guide you through a safe tapering plan or explain why it's essential to continue. Rule number 6 could save your life. Respect the process. Follow the plan. Don't pull the plug on your progress. Stick around. In our final segment, we'll recap all 6 rules to mastering your medications, maximizing benefits, and minimizing side effects. If you want to get the maximum benefit from your medications, and keep side effects to a minimum, here's the secret that often gets overlooked. Consistency is king. The best medicine in the world won't help if it's not taken regularly. So how do you stay on track? Simple. Build your medications into your daily routine. Make them automatic, effortless, a part of your life. Start by anchoring your medications to habits you already have. Take your pills right after brushing your teeth, or with your morning coffee. Do you walk your dog every morning? Eat lunch at the same time. Use those natural cues to remind yourself. Because the easier you make it, the more likely you'll stick with it. Do you want an extra layer of support? There are amazing free apps like MediSafe or DoseCast that can send reminders, track your doses, and even notify a family member if you forget. Or go old school. Set recurring alarms on your phone or write it in your calendar. The goal is simple. Never forget a dose. Visual tools can make a world of difference. Ask your pharmacist about weekly pill organizers, or even blister packs that are pre-filled and labeled for each day. Seeing your doses laid out clearly removes confusion, builds confidence, and gives you one less thing to worry about. Taking your medication shouldn't feel like a chore. It should feel like brushing your teeth. Second nature. Normal. Built into your life. And when it becomes part of your rhythm, you unlock the full power of your treatment. Better results. Fewer side effects. More control over your health. So remember, don't leave your health to chance. Design a routine that works for you. Stick with it. And take every dose like your future depends on it. Because it just might. Before you take your first dose of any new medication, stop. Don't just grab the bottle and go. Your pharmacist is one of the most accessible and underused resources in healthcare. They can literally save your life if you ask the right questions. So what should you always ask your pharmacist? Let's break it down. Number 1. What is this for? Knowing why you're taking a medication gives you purpose and helps you recognize whether it's working. Is it for pain, blood pressure, preventing infection? Ask, because being informed makes you empowered. Number 2. How should I take it? Should you take it with food? On an empty stomach? Morning or night? Some meds work better when taken at specific times, and some can upset your stomach if you don't follow the instructions. A simple question like this can prevent uncomfortable side effects, or even treatment failure. Number 3. What food, drink, or drug interactions should I avoid? Grapefruit juice, St. John's wort, alcohol, even coffee. They may seem harmless, but they can seriously interact with your medications. Always ask about interactions, especially if you take supplements, OTC medications, or drink alcohol regularly. Number 4. What if I miss a dose? We've all done it. You forget a dose and panic. Should you double up, skip it, take it later? The answer depends on the medication, so get that info up front. This one question could literally prevent an accidental overdose. Number 5. How should I store it? Should it go in the fridge? Stay dry. Avoid light. Your bathroom medicine cabinet may actually be the worst place to store your medications because of humidity. Incorrect storage can weaken the drug or even make it unsafe. So always clarify before you leave the pharmacy. Look, asking questions doesn't make you annoying, it makes you a smart patient. Pharmacists want to help, so speak up. Stay curious. Take control of your health. Here's a quick cheat sheet. Ask: 1. What is this for? 2. How should I take it? 3. What interactions should I watch out for? 4. What if I miss a dose? And 5. And how do I store it? Coming up next, let's recap all 6 rules for medication mastery and give you a checklist to protect your health for life. Let's bring it all together. If you've made it this far, congratulations. You're now ahead of most people when it comes to medication safety. Here's your ultimate checklist to take medications properly for maximum benefit, and with the least possible side effects. 1. I know each medication's name and purpose. You should never take something without knowing why you're taking it. Knowing the name and the purpose of each medication gives you control and peace of mind. 2. I follow the correct timing and food instructions. Some medications need to be taken with food, others on an empty stomach, and some at specific times to work effectively. The right timing can make the difference between a drug that heals and one that harms. 3. I never skip or double doses. Missed a pill, don't panic, but don't double up either, unless your doctor says so. Skipping or doubling doses can cause dangerous swings in your body, or make your treatment fail. 4. I've checked for interactions. One of the most important safety steps. Foods, drinks, supplements, even other medications, can interfere with your treatment. Always check, always ask. 5. I store medications properly. No, the bathroom medicine cabinet is not ideal. Humidity, heat, and light can degrade medications. Ask your pharmacist how each one should be stored to keep it safe and effective. 6. I won't stop any medication without consulting my doctor. This one is crucial. Just because you feel better doesn't mean the job is done. Stopping suddenly, especially with antidepressants, blood pressure meds, or antibiotics, can lead to withdrawal, relapse, or resistance. Always talk to your doctor before stopping any prescription. This checklist isn't just about being a good patient. It's about protecting your health, your future, and your life. You wouldn't fly a plane without a checklist. So why should you treat your health any differently? Be informed, be consistent, be empowered. If this video helped you, help someone else by sharing it. Hit that like button, subscribe for more practical health tips, and comment below. What's one medication habit you plan to improve starting today? Because when it comes to medication safety, a little knowledge can save a life, maybe even your own. Let's close with this. When it comes to your medications, you are not powerless. You are not passive. You are the pilot, and you have the power to make your meds work for you, not against you. Taking your medication isn't just about swallowing a pill. It's about showing up for your future. It's about giving your body the best chance to heal, stay stable, and thrive. Ask questions. Track your meds. Stick to the plan. Ask your pharmacist. Ask your doctor. Use reminders. Use apps. Do whatever it takes, because consistency is key. You don't have to be perfect, just committed. Maybe it's your grandmother or grandfather. Maybe it's your friend who forgets to take their blood pressure meds. Maybe it's you. Share this video, talk about it, and let's change the way we manage medications, a person at a time. That's the formula. That's the gold standard. Right dose, right time, right way, right duration. It's not just a mantra, it's your roadmap to better outcomes. Be informed, be intentional, be your own health advocate. If this video helped you understand how to take your meds the right way, do us a quick favor, comment, and remember to hit that like button if you learned something new. And don't forget to subscribe, so you never miss life-saving medication tips and health hacks. Remember to drop your questions or experiences below. We love hearing from you. Tell us in the comments, what's your biggest challenge when it comes to taking your medications consistently? Share this video with someone you love, especially your parents, grandparents, or anyone managing chronic conditions. You might literally change their life. And if you want to keep building your health knowledge, tap that notification bell. We've got more powerful videos on the way. You have one body, one life. Take control of your health, one pill, one question, one smart choice at a time. Thanks for watching and see you in the next one.